PET adaptive therapy has been sort of in vogue, at least for the last 5 to 7 years, and there have been multiple clinical trials which have utilized PET adaptive therapy, and those are going to be listed in the presentation. And the reason is that about a little more than a decade ago, a paper was published showing that patients who had a positive PET scan after 2 cycles of ABVD, known as the interim PET scan, had poor outcomes, and patients who had a negative PET scan had much better outcomes. And so that almost trumped the standard prognostic factor called IPS in Hodgkin lymphoma, and many clinical trials were designed to sort of look at ways and means to improve the outcomes of PET positive patients after the interim PET scan, and they were dose escalated up to BEAR-COP. And there was one trial where they used a regimen called IGEV followed by autologous transplant in a means of dose escalating to try to improve these patients who had very poor outcomes apparently on if they just continued on ABVD and see if the outcomes can be improved. So with those trials, the PET positive patients had showed PFS in the 60 to 70% range after dose escalation, and the PET negative patients were in the 80 to 85% range.